I'm Ann Kim, and I went to Botswana in spring 2011. I looked at infant circumcision as a long-term measure for HIV prevention, but along the way I also reported on cervical cancer as well as some cultural pieces looking at cattle herding and cattle herding
and retirement.
Cattle herding and retirement. Cattle herding as retirement. I've been tracking the circumcision story for about 4 years, three to 4 years, and was looking for the funding to go and actually do it, and so this was the perfect opportunity, so I applied with that story in mind. I think maybe not just reporting on health, but just generally, it's something that I keep in mind, both being a foreigner and being a woman. In particular, and I think being a foreigner in some ways, obviously there's a lot more learning you have to do with the cultures and sort of cultural practices, the way you dress, everything, from sort of small details to big things. But it also gives you access in a way that people are actually, I find sometimes, more willing to tell you something because you're a stranger and you're not sort of in their circle. I think there's some safety. It's almost this sense of talking to a stranger. Sometimes it's easier than talking to somebody who's in your culture. So oftentimes when I'm talking to somebody, I try to make them, obviously feel as comfortable as possible. But I just find that sometimes people are just more willing to speak. I mean, sometimes the cultural barriers are kind of outweigh that, but sometimes, there are opportunities where people feel more comfortable. Sometimes also being a woman, it makes people perhaps feel a little bit more comfortable. In the circumcision story, I spoke to mothers who had decided to circumcise their babies or were thinking about it. And so there was some resonance there. I also spoke to men about it, which is also very interesting. I mean, we were talking about very private things, obviously, private places. So sometimes it would be a little bit awkward, but then again, being a foreign woman in a way actually helps because you're not from the same society. So it creates some barriers, but then it also creates some room for a different way to get in on the story. I don't know if I told you the story. One afternoon, I was at a restaurant and I was reading a book, and the waiter said, "Wow, that book must be really interesting. You just haven't been able to take your eyes off of it." And I flipped the cover and I said, he said, "What is it about?" And I said, "It's about circumcision." And the first thing he says is, "Well, I really want to get circumcised." So I took it as an opportunity to interview him, right? So I thought it was sort of an average guy living in the city, being a waiter. So I interviewed him the next day, and we're talking. Of course, you start getting into people's personal lives because one of the reasons that a lot of men will want to do it is if their female partners encourage them to do it. It's been shown to reduce the transmission of HIV from a positive woman to a negative man up to 60%. So in his examples he wasn't in a relationship, but in his examples he would say, "Well, let's just say I had a girlfriend named Anne."
Did he know your name was Anne?
Yeah. So we sort of, he went down that path a little bit, and I would steer him gently away from that. But, and I didn't feel particularly, threatened by it. But there is this way in which you can sort of slide, and as a woman, you're constantly sort of aware of these things and you just have to be, especially if you're going to places in cultures where women, where the gender dynamics might be a little bit different than our home countries.